This is Abéché, the biggest city in eastern Chad. This cosmopolitan city has grown incredibly since the beginning of the Darfur conflict in 2003. Every day, it welcomes newcomers. Here at the bus station, Amine Saleh Jibreen and her big sister have only just arrived. After a particularly long and difficult delivery, Amine has been suffering from a condition. For 4 months now, she has been unable to control her bladder. So she is taken from the bus station to a specialized healthcare facility called the Village of Women. The first person she sees is the psychosocial worker.
I meet the patient and ask about who she is, where she comes from, the history of her condition, the number of children she's had. I try to find out if she's married or divorced. I get all the information before I send her on to the nurse. The incoming patients usually come from the countryside. They aren't used to this kind of building. They aren't used to this kind of staff either. So it's quite a stressful environment. We're here to listen to them and offer them moral support before the surgery.
The 17-year-old woman who got married 2 years ago is now ready for the consultation with a nurse. To confirm Amine's condition, a specialist needs to diagnose her.
We have just examined the patient. It is indeed a fistula. It is a vesicovaginal fistula, meaning an abnormal connection between the bladder and the vagina.
Obstetric fistulas are often caused by difficult childbirth or induced abortion and have many consequences.
The permanent urine flow will cause rashes on the external genitalia, and they will make infections more likely. These infections will reach the upper urinary system as well as the genitalia. This will have consequences. For example, in the upper system, meaning in the kidneys, it can cause a pyelonephritis. With time, it can also cause renal failure. Gynecologically speaking, it can cause issues that will prevent conception. And there are social consequences. A woman with a fistula is first abandoned by her husband, then by her family and friends. She is rejected, and that is a major psychosocial issue.
Now that the young woman knows for certain what she has contracted after needing 3 days to give birth to a stillborn little boy, she will see the psychosocial worker again to get the necessary setup to move into the Village of Women.
There are these 2 bed sheets here. This is a blanket inside, a kettle. This is for the gruel. There's a glass and 2 bars of soap for hygiene. This will allow them to wash their clothes. There are also 2 mosquito nets. Here. 1 net for the patient and 1 for her companion. And these 2 dresses here.
The newcomer, traumatized as she is by her condition and the loss of her baby, will no longer be alone. All these women, most of whom have known the pain of childbirth before they were 16, are waiting to see the specialist about fixing their fistulas.
My name is Zara Hissène Abdelkarim. I'm 15, and I've been married for a year. I became pregnant during that time. After 9 months, when it was time to give birth, the labor was very difficult. I spent 4 days at home before I was taken to the hospital. On the 5th day, they pulled out the baby who was stillborn. 10 days later, I started to leak urine. I couldn't control my urinary opening. For 2 months, my mother and I went from healthcare center to healthcare center, trying to find a solution. Fortunately, now that I'm here, I have everything I need. My husband says that my childbirth was so difficult because I committed adultery.
Women with fistulas are most often accompanied by their mothers.
When your child is in pain, as a mother, you are in pain. I had to run around everywhere looking for a cure because nobody else in the family cared about her. Her husband never visited us, even once, while we were going to all these healthcare facilities.
Women with obstetric fistulas are often rejected by their husbands.
What man would care for a woman that keeps leaking urine? My husband doesn't want me anymore. If I recover, he will try to come, but I will never take him back.
Before the surgery, women with fistulas are provided with regular follow-up as the medical staff checks on their health. The physical therapist plays an important part in the care of patients in need of physical therapy before their fistulas are fixed. At the village of women of Abéché, the psychosocial worker often organizes an art workshop for women with fistulas. Although this activity might seem insignificant, it is in fact heavy with purpose.
The patients draw what they want. They often choose distant memories. The husband that rejected them, the child that died, the family or friends that remain in their village. It's a way to bring them together. They chat. It allows them to forget about their condition for a little while before the surgery.
It's a special day for Aminé. She is in the OR. As she comfortably waits for the surgery, Aminé is given the anesthesia. It will numb her sensations and ease the repair of the fistula. The surgery is about to start. Dr. Valentin is scrubbing in before he gets to work.
First, we separated the anterior vaginal wall from the bladder, since they were stuck together. So you have to separate them. Then the part of the fistula with fibrosis had to be taken out, all of it, so it heals well. And then we closed it.
The success of an obstetric fistula repair is determined by a certain number of factors.
There are 3 parameters. The tissue needs to be good quality. There is also the size of the fistula. When the fistula is too big, then you need a lot of practice to manage to close it properly. If the tiniest hole is left, the woman will keep leaking urine. The third parameter is the location of the fistula.
Amine and her friends spend 3 weeks in this room of the maternity ward at the regional hospital of Abéché before they go back to the village of women. Dr. Valentin and his staff watch over them daily.
The checkups matter because these patients are just out of surgery, and we want to make sure that the catheter isn't blocked, since it has to drain well for them to heal. We also took care of vulvar and vaginal lavage at the same time, so it's all clean.
Once their catheters are out, Amine and her companions stay in this building without paying a dime, like everywhere else in the village of women, before they leave. They will come back in 3 months for a checkup to confirm their recovery. If they follow the advice of the medical staff and pay attention to the messages conveyed in awareness-raising informational and educational meetings, they will be able to give birth thanks to a C-section and recover their zest for life, like their sister, Hawa Mahamat Saleh. Obstetric fistulas trigger social issues. In order to prevent and fight them, awareness-raising meetings are held everywhere in Chad. Illiteracy, preconceived ideas, and the weight of traditions are all obstacles to the struggle against obstetric fistulas, which main encouraging factor remains early marriage.
When a girl turns 12 and you don't marry her off, she might disappoint you by turning up pregnant anyway. She could even give birth to a bastard child. So when someone wants to marry one of our girls, we always say yes. If a girl isn't married by the time she's 20, she can't give birth anymore.
Fortunately, the opinion leaders and various levels of the authorities are getting more and more involved in the struggle against obstetric fistulas.
Fistulas are often caused by early marriages and by never visiting healthcare facilities. I do not like seeing a woman leaking urine and feces. She will be left by her husband and then by her parents. I urge everybody to stand against early marriages.
Preventing and fighting fistulas means enforcing the victim's right to physical integrity and helping them thrive as they recover their zest for life.